I'll talk about it from kind of the technical standpoint first. Waverly is a hospital. We are smaller. We're a critical access hospital, and we're in a rural state. Okay, so first and foremost, the complexity of what we're seeing here in Waverly and our capabilities are not that of a hospital in downtown New York. So that, in conjunction with how spread out we are, we have a very, we have an educated population here that's conscientious of one another. I think, just kind of those Midwest values. And so we have not seen some of that. We haven't seen that surge quite yet. We haven't seen that huge impact on the hospital, right? When we're asked to social distance, we social distance at home, and our houses are, a quarter of an acre apart or whatever. Whereas in New York City, everybody's, living in an apartment building and they're sharing a common ventilation system. And you're cramming an awful lot of people into an extremely small space. So, we're kind of lucky there. More specifically to Waverly, it's not like a restaurant where, there's kind of this call to action where you can say, you know what, hey guys, we are thankful that we have the variety of restaurants and services that we have in this community. Make sure that you are giving them your business, right? Or you're thinking about going to East Bremer Diner for dinner, and keep them top of mind during this very troubling times. We want to help them get out of there. We absolutely have people in this community that are extremely thoughtful about the hospital, but it's a little bit different, right? Yeah. There's nothing that they could do to kind of stimulate or to help prop us up. But what we have seen are a lot of well wishes. We've had kiddos from various churches that have come and written sidewalk chalk, real uplifting messages. You guys have fed us. We've had the pizza places feed us. Today we had Jimmy John's Excel Group, Farmers State Bank came in, and thinking about the employees. Realizing that there are little things like that that really go a long way to show the appreciation of the staff who truly are. These nurses are charging into harm's way. Our environmental services, they're marching right into the the teeth of the virus, and they're on the front line making sure that if somebody does come here, that they're not taking it out of here too. What we have here is really a good community of hospitals. We have competition with the hospitals in Waterloo, but for the time being, what's been really cool is we've had these competitive barriers really come down, and we've had this really collaborative approach to this, okay? So Allen Hospital is very good at managing those ICU patients or patients that need to be on a ventilator or need a higher level of acuity room, okay? What we're really good at is that kind of high touch. We can really take care of the person really well here. And with kind of this coordinated effort, if it comes down to it, we can take those patients off of Allen's hands so that they can see that higher level. So really do like that. We really like that, we can all work together. And it was very quick that all the hospitals, it was Allen, Grundy, Independence, Sumner, Manchester, all said, look, okay, this one's different. Let's get on the phone. And from right away, we're all talking about how can we do what's right. It takes everybody here, our doctors, our nurses, our environmental services staff, our facilities guys, just everybody has their hands in this right now. So again, really proud of just this team effort that's gone on here. People are taking it upon themselves to say, what can I do? I have access to X, Y, and Z. I can make masks. I can make gowns. I think that gowns will ultimately be the first thing that we'll need access to if there is a big surge. But honestly, right now we're in a pretty good spot with regards to our PPE. One of the things that we're really hoping for is that, we understand that shipping channels have opened back up from China. And so, it's us that are having the coronavirus issue now. And we're hoping that some of the manufacturers of that PPE are going to be able to get them to the U.S. Here in the near future. So again, if we can get through this peak and we can still maintain some access to that PPE, I think that we're going to be just fine.
Awesome.
We are just standing at the ready, which is what we, right? That's what needs to happen right now to protect the community and to make sure that we are ready for that influx. But you're absolutely right. We are staffing as though we are doing surgery, that we're full of inpatients, that our clinics are busy, and they're not. You know, the right thing to do right now is to limit the exposure and to keep people at home the best they can, unless it's life-threatening. And so we have all of our expenses in place and none of the revenue coming in.
So as a business guy, I hear that and go, man, so what do you change and what do you, but the hospital's so different. It's not a business like we think about other businesses. So what's that look like for the hospital over the next 6 or 12 months?
Yeah, I think that you kind of said it, you said it best. If the government hadn't stepped in, we'd be in a much different situation, right? We have funding that's going to help us bridge. I think that, you know, the state and the federal government to some degree have recognized that, you know, we are being required to stay open. Again, right thing to do, and not bring anything else in. Okay, it's not appropriate for us right now to be laying people off. It's not appropriate for us to be not ordering supplies and to, you know, shut down units. No, we have to maintain everything as though we were busy. And so, you know, we have some pending dollars coming in through grants and some other sources that should help us bridge. We are anxiously awaiting notification from the state as to whether or not we'll be able to open up come May 1st. I think that we're all waiting to hear about that. But for us specifically, we have patients that need surgery. We have patients that need medication and that need their well child visits. We'd really like to get those people back on track, not just for the revenue, but for the health of the community, which is, you know, ultimately why we're doing what we're doing right now. It's hard. We understand that. We understand that nobody likes the social distancing. Nobody likes staying at home. I believe in the direction that the governor has been taking us. I believe that the experts are guiding her appropriately. Listen, we're going to get through this. And really, I think that if we can just pay attention and if we can just hold on for a few more weeks, we're going to get through this peak. And there are definitely brighter days to come.
Awesome.